Hey guys, I am here with Rocky, post-op nurse Rocky. Uh, gonna try something crazy today. So you probably know about half, or maybe even more than half of my patients join me now from not St. Louis. So half, or even more than half of my patients travel in from somewhere else. And today, one of my patients that the person I operated on came in from Arizona with her fiance. Super nice woman. Her name is Laura, and her fiance's name is Romaine. And Laura and Romaine came in from Arizona today. I did Laura's under eyes. I did her nose. I did a little bit of fat transfer. And then just kind of we had a little bit of a last minute throw in. I asked her if it would be okay if I put a little bit of filler into her chin. And so I always do a call with my patients the evening of surgery, and it's a telephone call. And I was making a telephone call with her, and I just kind of on a whim said, "Hey, Laura, can we stop this telephone call and switch it to an Instagram Live?" Because she's being very open about her process. And so we didn't finish our telephone call. I did the very beginning of it, and then we decided that we were going to finish it by Instagram Live. So what you're about to see is kind of the video version, the Instagram Live version of what I do when I call and check in my patients the first night after surgery. So I'm going to look for her here, and I'm going to see if I can find her and have her join in with me here. I think I saw her username a second ago. Laura, I saw you a second ago. Let's see. I think this is you. Let's see. I had to find you in the list here. I clicked on your name, but now it's the entire list that's coming up, so bear with me. I wonder, Laura, can you request to join and see if that would work? Let's see. Here we go. Okay, we should be joining up soon. So for those who's just joining on, Laura, who's about to join me now. Hey, Laura, how are you?
Hey, I'm good. How are you?
Good. This is crazy. I've never done this before,
It
and
is, but I'm excited.
there's probably a reason. Yeah, the reason half my patients coming from out of town is because we fixed everybody in St. Louis. That's exactly right. But there's probably a reason people don't do Instagram Live interviews of their patients a couple hours after they get home from surgery.
Right.
So Laura was my first surgery today. Would you tell people what we did for you today?
Yeah. I had a rhinoplasty, a lower bleph, and we ended up doing a little bit of filler on my chin. That was like a last minute thing. And that was it.
Yeah. And we finished up Laura's surgery about 5.5, 6 hours ago, something like that.
Yeah.
Laura, you are sporting your beautiful robe. You want to show them the logo on that robe?
Yes, I absolutely love it.
So everyone that gets surgery, we instead of sending them with a chintzy little cotton robe, this is Joni and Julie's idea. We do a nice kind of comfortable robe to go in.
I love
So,
it. Thing.
well, let's start your normal post-op check. So I normally call the evening of surgery, and I usually try to have the person and their in this case fiance. There's Romaine in the background.
Yep.
Whoever their caregiver is on speakerphone, so we all three can hear together. And let's just do it. How do you feel?
I feel pretty good. No pain at all. Just a little bit on my nose and like my lip, my upper lip, but that's about it.
Are you feeling really numb, like in the upper lip especially?
I am, yes, absolutely.
Yeah. So I gave you at the end of surgery a very, very, very long-lasting numbing injection.
Mhm.
It's like an epidural for your face. Okay, so your face will be numb. The middle chunk will be numb all the way through this evening, and by tomorrow morning it'll wear off.
Perfect. That's
Okay.
exactly good.
Yeah, that's what you want. So that way you have next to no actual pain. So
Uh,
Tylenol should be sufficient for your pain.
right.
Um, I did your under eyes,
Yeah.
and the viewers can't see the incision is behind. You can't see it either. The
Hmm.
incision is behind the eyelid, and once in a while, the very fresh incision, just like the nose will sometimes drip a little bit of blood, so you have your drip pad on.
Yes,
The very first eyelid incision once in a while will drip a little bit of blood. And you had a little bit of bleeding, didn't you?
I did. Yeah, you could barely see a little bit of it right here.
Yep, absolutely. You can take a little damp washcloth when we're done, or a little Q-tip if you have one, and just kind of gently brush that away. Or you can ignore it and it'll come off on its own the next little
Yep.
bit. Do your eyes hurt?
They don't. Not at all.
Good.
Yep.
All right. And again, this is the stuff I normally go over in the post-op calls. Are you having any nausea?
No.
Feeling pretty clear-minded?
Yes. Yep.
Do you remember actually going into the operating room?
I do remember like sitting on the table and that was it. Yep.
And then what's the next thing you remember after that?
Waking up.
Okay.
In the waiting room. That's all I remember.
Super. Well, Laura was not under general anesthesia. She was under deep sedation. But as you're about to see here in these little pictures, I'm going to show Laura her before and after pictures. I'm going to send them to Romaine's phone here in a second, okay?
Oh my gosh. I'm really
So, Laura has not seen these yet. But you'll see she's got stickers on her forehead, and that's a brain monitor that reads her consciousness. And so we do this so that we can keep her completely unaware. You didn't feel or remember anything during surgery, right?
No, nothing at all.
And yet she is wide awake and bright right now. And so we want to give you as much anesthesia, but no more than you need.
Yes.
So we already talked about pain. We already talked about nausea. Do you have questions about the aftercare instructions as far as what medications you should be taking or anything like that?
No, I don't. Not at this point. You guys were very clear, very thorough. So at this point, I don't have any questions.
Okay. And I just want to tell you, if when we hang up here, there's something that you didn't want to ask in front of all the people, please call me back. Okay?
Yeah.
Like in real life. Romaine, are you feeling pretty good about the instructions for taking care of her?
Yes, it's very clear. There is like a page back and forward about it, and it is very clear, very detailed. There is the hour as well on the medication itself, but things are repeated, and for people like me, it's great. So, and
well, good.
Hey, like I did have some question, and I did ask them. I sent text to your staff, and they answered right away.
They're wonderful.
As well as you passed the hours, I texted you, and you answered as well right away, and reassured us right away.
Yep.
So for those of you who don't know, people that have surgery with me have 24-hour access to questions, literally 24 hours. So during the daytime, I have them call or text the main office phone number. Because I'm busy during the daytime and I don't see my cell phone. And so my operating room staff is watching all day during the daytime, so immediate response. And then evenings or weekends, they would call or text me if they had an emergency. The same thing, immediate response. So there's 24 hours a day, they have somebody just perfect. So someone was asking where you're staying, by the way. Where are you staying?
I'm staying at the Sonesta Hotel in Chesterfield, I believe.
Yeah.
It's about a 12-minute drive to your surgical suite.
Yeah. So we have a few things that we recommend. One is if you're only staying a night or two, there's a hotel right next to our office. It's the Frontenac Hilton. It's incredibly convenient, but the rooms are a little bit smaller. It's not quite as comfortable because it's just one room, and it'd be hard to spend a week there. So if you're spending a few days, and Laura and Romaine are actually going to make a trip out. So she could have easily flown home today. You can tell with Romaine's help, she could have gotten home today, no problem. Yeah. But they're actually going to explore St. Louis. They're going to see the botanical gardens, the zoo, Union Station, maybe the Budweiser Brewery. We have a bunch of fun stuff here. Maybe catch a Cardinals game. I mean, it's a fun city.
That would be awesome.
So they're making a trip of it. So they're staying in a little. It may not be as luxurious, but it's a lot nicer because it's a couple rooms. It's more of a suite situation, and it's just if you're going to spend a week, it's much better.
Yeah.
All right.
Everything, so it's great.
So I've been torturing you enough. There we go. I just hit send. I just sent this photo to Romaine's phone.
All right. And I got it.
Oh, I heard it. So this is the first time she is seeing her. Go ahead and take a look.
Who I'm seeing.
Oh my gosh.
This is the first time she is seeing her brand new.
Oh my goodness. Wow, I love it.
Is that cool?
Goodness, yes.
So that's her brand new nose, and actually we did. Now the chin looks exaggerated because the shadow is exaggerated. I promise it's not.
Gosh.
But we did tweak the chin just a little bit. So that is Laura on the table.
Love it.
What's it like seeing a completely different nose on your face?
It's so weird to me, honestly. I can't wait till get the cast off and actually see it in person. It's such a good feeling, honestly, and thank you so much. You guys have been so wonderful.
You're very welcome. So I'm gonna let you go here in a second. So somebody asked, when can she go out in public and look normal? She can go out in public now. The drip pad will be gone by tomorrow, so it'll just be the splint and the swelling.
Uh-huh.
But the drip pad will be gone by tomorrow. But under a mask these days, you could go anywhere you want with everything on right now, and no one would know
Like,
anything.
yeah. Right, right.
So, anything else you want to say before I let you go? I want to let you get some chance to recover.
No, honestly, I'm very excited to see the final result. You guys have been absolutely wonderful, and Dr. Nayak, you are just the best at what you do. And I'm very excited and just happy I chose you.
Well, thank
Thank
you.
you
And
so
listen, so many people already have said thank you. Other people will watch this in the future. They're going to want to say thank you, and I want to say thank you myself. So I will let you go. I
Thank you.
really mean it. If there's a question, Romaine, if there's a question you have, or Laura, there's a question you have that you're like, I don't want to ask in a live thing, just call me back and we'll go
No,
over
I'm
it.
not. I'm getting actually emotional. It's even me as a bystander. It's pretty impressive. You're an artist, and
You
Thank
know,
you.
I waited so long for this moment, and I've been following you for what, 5 years now, and I'm so happy I finally made it out here. So
It's not convenient. We're not in New York, we're not in LA. It's not the most convenient place to come. But I'm glad you came, and I'm happy you came, and it'll be worthwhile.
it's been wonderful so far. So thank
Cool.
you.
You're welcome. All right, I'm going to hang up. I'll answer a couple of little live questions here from the just people following, just to have them for a few minutes. But I'll let you recover,
All
and I
right.
really mean it. If you have any questions, you answer. You call me and answer. Call me and
Will
ask.
do.
Okay.
Will do.
All
Thank
right.
you so much. I appreciate it.
You're very welcome. I'm
Goodbye
not
now.
sure. Okay. I think maybe you click in. I'm not sure how to.
Uh,
Let's see.
I'm not either. Let's see.
I don't either. Let's see. Invite to
If I
join. Maybe just X out. You can join back in and watch. That's probably the thing to do.
okay.
All right. So meanwhile, what should be done first? I'll ask a couple questions. Do anyone have questions related to Laura or her healing, or what you just saw so far? And then I'll answer a couple generic questions. Then I'm going to let you guys go for the night. Let's see. What should be done first? Jaw, chin implant, or deep neck lift? I would do them together. It's the same incision, and I'm actually sizing the chin based on what I can get done with the neck. So it's the important things to do them together. Does she stay there for free? No, she doesn't. We have financial arrangements with a couple of local hotels where they give us deals, but it's not for free. The CRNA moms love my work. Well, I love CRNAs and CRNA moms, so thank you very much. What procedure did she get done? So she had her nose done. I did a rhinoplasty for her. She also had a tiny bit of chin filler. Can't see if I can get this to focus. And she had a under eye. I did her lower eyelids. So there you have. How's my hair looking? It's looking okay. I think we're getting there. It's mostly grown back. I am in St. Louis, Missouri. Someone asked where I am. I'm in St. Louis, Missouri. Let's see. What a sweet support system. Yeah, Romaine is phenomenal. I only just met him today, but he is absolutely phenomenal. He's really cool. One or two more, and I will let you go. Let's see. I'm just so grateful that she decided to let me share her checkup visit. It's really unusual. So I thought, let's just try it, something new. All right, last couple. Cheek lift help with under eye bags. Yeah, a cheek lift can help with under eye bags, but usually you really have to address the under eyes directly to really get them treated. Do I do video consults? Absolutely, I do video consults. About half of my patients are from out of town, a little more than half these days. So unless it's a revision rhinoplasty, I can do a video consult on pretty much anything. On a revision rhinoplasty, I need to look inside your nose. I need to feel your nose. It's a very specialized thing. So I don't do video consults on revision rhinoplasties. Somebody's mom went to me. That's all. Does she look like your sister now? That's what I want to know. If you're unsure of the look you want for your nose, can you see different options computerized on yourself beforehand? Yes. So if you're here in real life, we do it on a 3D camera. If we're doing it virtually, we have you submit it to us some really clear profile and front view pictures, and we will do your imaging just on Zoom. So yes, you get to see for sure. Our video consults free? Unfortunately, they're not. I put in the same amount of effort into a video consult as I do in a real consult, and I only have time to do about 2 consults per day. So what is free is a free photo screening. So I'm going to stick in here how you get a photo screening. And the photo screening, truthfully, we don't charge for that. I look at every photo. No, I'll put a post up on my story. It's not letting me put all the information in there. And that is complimentary. So we don't charge for that. And we do give you everything you need to know, including cost. But then an actual live consultation, whether it's in person or on Zoom, since I really only have time to do 2 of those per day, we do charge for those. What am I talking a little bit about twilight anesthesia? Yeah, so the face is an interesting place in the body. I can make the face completely numb with lidocaine. So once the tissues are completely numb, there is no more pain. There's minimal stimulation. So we don't need general anesthesia like when you're working deep in the belly or in the chest cavity or in the brain or something like that. Since all the tissues are numb by the time the lidocaine goes in, we don't need general. And so the sedation is deeper at the beginning of the case. For all the CRNA moms out there, we have them dissociated for about 20 minutes while we inject all of the lidocaine. Then we'll let that dissociation wear off, and all we're doing is monitoring consciousness and treating pulse and blood pressure. And that's it from there on out, because we have no pain. So it's actually completely opioid-free anesthesia. It's opioid-free, and most of the time we don't even use a benzodiazepine. It's very clean. And post-operatively, we give our facelifts and brow lifts or neck lifts. We give those kind of bigger procedures 10 pain pills. Nobody runs out of 10. Half of them don't take any. Littler things like what Laura had, they don't actually get any narcotic pain pills at all. They get Tylenol and they get gabapentin, which is kind of a neuromodulator, but not even codeine. They get nothing, and they don't need it. Why did I choose to be a face expert? I don't understand why people choose to be other things. I mean, the face is where it's at. So it's been my passion all along. It's absolutely what I love. Yeah, Sandy D here. Sandy's very public about having had surgery with me, and she's chiming in that she didn't need pain pills at all. Thank you, Sandy. I appreciate it. Let's see. Online activity helps keep the anxiety level down. Well, good. I'm glad. My goal is to educate you, whether you end up with me or somebody else, is to educate you as much as possible so that you make good decisions and you know what will improve, what won't improve, what could go wrong, what might go wrong, how we'll treat that, what to expect. This is real stuff, and so it's important before you jump into it, you understand what you're getting into. Do I do custom chin and jaw implants? Custom chin, yes. Angle of mandible, no. I don't do those. Oral surgeons do those most of the time. Do we have Airbnb type places we recommend? We actually do. Where am I? I'm in St. Louis, Missouri. Go figure. This is where my family's from. This is where my wife's family's from. And so my kids are older now. One's off in college and one's a sophomore in high school. But for the almost 20 years leading up to that moment, my kids got to be really close with their grandparents, and I get to see my parents, and that's and Avni gets to see her parents, and so that's why we're here. We talked about massage post rhinoplasty. I actually have a video about taping and massage on my Instagram TV, so check it out. A young girl from Connecticut is my model on that one. I teach about taping and massage and go into detail. But the bottom line is I think it needs to be very specifically individualized per patient. So I only recommend taping and massage to about half of my patients, maybe less than that. And each one is kind of unique. But on that video, you'll see what I recommended for her and how to do it. Jans Brunner, excited to get the robe in November. It's kind of a prized position. I'm not going to lie. People love the robe. All right. I'm going to let you all go. Thank you very much for joining me. Thank you to Laura for doing this crazy live the evening of surgery. It was very nice of you. Congratulations on your new nose. Congratulations on losing your bags in St. Louis. I got to trademark that. Lose your bags in St. Louis. And I hope all the rest of you have a great night. Take care.